Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane for the Ask Dr. Pane segment, where the doctor will answer your question about cosmetic surgeries and plastic surgeries. And Dr. Pane, this question comes in from the Twitter crowd this week. A lady from New Orleans. She's lost a lot of weight. Congratulations. Looks like the question is, this lady has lost weight. She was originally 300, since lost 75 pounds. She feels a little bit sloppy everywhere. I'd like to know what procedures are suggested to help her out. She does have Medicaid, and apparently they will pay for the excess skin removal, but she would like to know above and beyond that, what are her options to improve herself? Dr. Pane, what do you suggest?
Well, that's a good question. And again, congratulations with the weight loss. As she may have found out, exercise does not tighten the skin. When you gain and lose weight, the skin gets stretched out. The elasticness of the skin does not return all the way. So some of that skin is going to need to be removed if it is a bother. Now, in terms of insurance coverage for skin removal, that is a possibility mainly for the abdomen, less commonly for the thighs, much less commonly for the arms, and certainly not for the breasts in almost all cases, because you have to have a medically necessary indication for surgery. That skin excess has to be so pronounced that the insurance would then cover it. And in most cases, that is not going to happen. So we do more of this for people on a cosmetic basis. Now, the main area to be addressed for her, looking at the photos, is going to be the abdomen. When there's that much weight loss, it'll be at least an extended abdominoplasty. Some people benefit from an up and down scar as well, but not everyone wants that scar, even though the regular, waistline abdominoplasty does not take out quite as much skin as can be taken out with that vertical scar, because that scar is permanent. You can't do anything about that. Once it's placed, it's there. So that's usually only when people have redundancy from above the belly button level. People tend to overdo this operation. A lot of people will regret the scar, so you have to think carefully about that. In terms of body lifts, where the scar goes all the way around to the back, that is needed in some cases when there's a lot of excess skin around the hips or even in the back. But in most cases, you can avoid that by just doing a good abdominoplasty and tightening the muscles on the inside, as well as removing the excess skin. So I would say abdominal procedure is mainly the first one to concentrate on. On, again, everyone's individual importance level. Some people are more concerned about the thighs, some people are more concerned about the arms, but I say for most people, starting with the abdomen is the best bet, because you get overall the best improvement, and you can see a big difference and get something really out of having lost that weight and being able to deal with the majority of the excess skin with that first procedure. Can be combined with some of the others. I like to keep the procedure not too long, so we make sure it's nice and safe and can be done as an outpatient. Again, I have a very low problem rate with any of these procedures. It is lower by far than all the stated publications that you'll see, and there's reasons for that, which we go over in an in-person consultation. So a little bit of a long answer, but hopefully that gets us started with what to do after excess skin after significant weight loss.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website or Facebook page. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.